Now, as some tertiary education students gear up to begin writing examinations today, how healthy is the environment within which these institutions, given that the most extraordinary 7 months of all our lives is what we are still currently going through, is with us? And of course, the continuation of classes during COVID-19, how has this affected students? Now, Higher Health, which works in 7 key areas to promote the well-being of students across South Africa's public universities, technical and vocational training colleges, are actually focusing on this very key issue. And joining us now to discuss this matter is Chief Executive Officer of Higher Health, Dr. Ramneek Ahluwalia. Dr. Ahluwalia, thanks for your time. Welcome to Morning Live.
Good morning, ma'am. Thank you very much, and good morning to everyone.
Such an important issue, especially against the backdrop of this pandemic that has just devastated the whole world. But firstly, how does higher health, I should say, interact with government's higher education institutions and students?
Absolutely, ma'am. This has been a very difficult year. In fact, Sakina, you will probably know that this year has been a year where students are very anxious at this moment. Academic year has been disrupted. Same thing goes with our academics and learners also. It's also exam time. And for Higher Health, the biggest issue is how do we put systems and controls across all our universities, whether they are rural or urban or semi-urban, all our TVET colleges. In fact, our TVET colleges are on campuses in Bizana, in Ladysmith, campuses deep down in Kailicha or Alexandra. So the aim is how do we put a holistic system where we prevent saving lives from COVID-19 and keeping in surety around, we don't want a situation where students are coming now to write exams for contact learning in the level lockdown 1, and they become breeding grounds for infection spread of COVID-19, which we've seen it happens very quickly due to the nature of the spread of the virus.
Indeed, and quite apart from...
So Higher Health...
please continue.
No, so what I was trying to say was just that it's our system and controls and putting training mechanisms, putting invigilators into...
All right. I think, what Dr. Ahluwalia has to say is so important, but unfortunately that connection not stable. So we'll have to try that again because it is such an important subject, especially now with institutions of higher learning starting their examinations. And I know many students are extremely anxious because of the lack of contact time and also the fact that they don't necessarily feel ready. And as Dr. Ahluwalia points out, there's also this added anxiety of returning to these centers of learning and perhaps, contracting COVID-19 and all of these factors coming into play. Dr. Ahluwalia, let's just try again, and I hope that the connection is better this time around. You were talking to us about your structures and, of course, the support that you offer on these campuses.
So I think what we have done is we've built about 13,000 frontline workers around all our campuses. And these are on-site trainings. It took us about 7 months, but we had to do it because many of our campuses didn't have the privilege. We come from communities, very poorly disadvantaged students. So contact learning becomes very important for us. Similarly, preparing our residences, our accommodations, our libraries. So it's every system that we need to look into. How do we avoid congestion at the gates? Our gates can become, because thousands of students are coming at the same time inside our campuses. Parallelly, it comes out, how do we train our management to put control mechanisms in all the spheres that we can help in not spreading the prevention of infections? Parallelly, we've also seen a huge rise of mental health. Now, this is a mental health month, but most importantly, exams come with mental health crisis, and this has been an unnatural year. So putting a crisis line together, 24 hours available, so that students can seek help at every level for this difficult year to be going through. So Higher Health job is in a complete holistic way to work with every campus in putting systems, putting controls, training, putting a mechanism, even as importantly as our building structures. We know this virus is airborne, it's spread through air droplets. Are our air conditioners, filters and cleaning systems, our windows not jammed, making sure there's cross ventilation, there's air circulation, so that we minimize as far as possible every step so that the infection doesn't spread. So it's a very detailed system that we have to put in every classroom, every community, every campus level, so that we end up preventing lives from there on.
And, speaking of mental health, Dr. Ahluwalia, what sort of engagement have you had with these institutions with regard to what students are currently going through? There's a lot of anxiety, there's a lot of uncertainty, and as one would imagine, students are just in panic mode at the moment because at the best of times, exams are stressful, but given this pandemic and the sort of challenges that this has brought about, one would imagine that students are even more anxious.
Ma'am, through your channel to every student in the country and right in rural areas, semi-urban, I want to give a number, which is 0800-363636. It's our crisis helpline. 20 hours. It's a toll-free. Any student, any staff member who is experiencing anxiety, suicide remains the second biggest cause of death in higher education. And we understand exactly what happened then COVID-19 to another proportion. So when I speak to management, vice chancellors, or speak to principals, or even student formulations, it's absolutely clear what kind of uncertain things have brought into our student community at this moment, while they are sitting alone in their homes and residences, trying to figure out how they're going to be completing this exam period or their academic year. We don't want, so 2 o'clock in the morning, 3 o'clock in the morning, we don't want our students to be alone. So a team of counselors, psychologists, social workers are 24 hours dedicated into this process. We want to make sure that this student of ours passes this crisis with someone. And of course, then we also have a backup clinical psychologists that are now in every province and districts, which will then come over to take a chronic case further and do the follow-ups. But the most important time in mental health is that crisis, is that acute time when the child or a student find himself alone, and how do we help him then and there, and he doesn't find himself alone in this matter. So that number is very critical for people to call and to engage and seek help at this difficult time.
Dr. Ahluwalia, just repeat that number for us, if you will.
0800-363636. I repeat again, 0800-363636.
Well, Dr. Ahluwalia, we'll leave it there basically because we don't have a very great connection this morning, but certainly something that we need to talk about at a later stage. Thank you so much to the CEO of Higher Health, Dr. Ramneek Ahluwalia, for talking to us about how they help to formulate institutions to try and prevent COVID-19 from spreading further, and also to deal with the psychological well-being of students. And you heard that number, and as Dr. Ahluwalia says, very importantly, when you find yourself alone at that moment, when the crisis sets in, please do not feel like you have to go through that alone. There is a 24-hour toll-free hotline number, 0800 363636. So please, you can call that number. Any student from any institution of higher learning, if you need to speak to someone, if you are going through a crisis right now, feeling anxious, feeling panicked about your situation, please make use of that toll-free number. Right, let's take a quick break, and then we'll come back and take a quick look at some more of your responses to our question of the day before we end the show.